Hello YouTube, this is Kitty Clinical here with another video, and today we're going to be talking about diabetes and whether it is a good idea to order an A1c. This is mainly for the outpatient setting. Most people who have underlying hyperglycemia or obese, maybe you've got some acanthosis nigricans. Yeah, you probably want to do an A1c to screen patients who are at risk, but there is a caveat. Now, not everybody who is simply overweight or obese should get an A1c. It really depends on the clinical correlation, the clinical picture. So what do I mean by this? Well, if you look at some of the links that I have put in the description, the U.S. Preventative Task Force has put out recommendations. This was actually pretty recent. This was in August 24, 2021. The timing of this video is now September 2023. The population is for asymptomatic adults aged 35 to 70 years who have overweight or obesity. And the recommendation is that the USPSTF, or U.S. Preventative Task Force, recommends screening for prediabetes and type 2 diabetes in adults aged 35 to 70 years who have overweight or obesity. Clinicians should offer or refer patients with prediabetes to effective preventive interventions. So, again, it really depends on the picture here, folks. Actually, if you remember from the recommendations a few years ago, I think it was in 2016, don't quote me on this, but the actual age back in the days was age 40, and so they've actually lowered the minimum, the lower end of that age group from 40 to 35 is my understanding. If anybody has to correct me, leave a comment down below, but that's my understanding, is they've actually lowered the threshold for the age, or rather increased the patient population by doing so. Now, I also linked another article from the AFP, and if you look under their key recommendations for practice, it shows that diagnosis of type 2 diabetes can be made using fasting plasma glucose, A1c testing, random plasma glucose testing, or an oral glucose tolerance test. Yeah, you probably don't order oral glucose tolerance tests unless you're pregnant. And all these other tests, I mean, the A1c we know is the best test, but you should keep in mind that when you order tests, they cost money. And so, depending on which patient you're seeing, I mean, if they have good insurance and, it doesn't really matter whether you order an A1c, it usually doesn't really matter either way. But if you really want the best for your patients, order the A1c on those who need it. If it's somebody who's got a BMI of like 26, 27, I mean, and they don't have they don't have a family history of diabetes, their exam is completely normal, you've reviewed their previous labs and they've been all fine, then maybe this patient doesn't need an A1c, especially if you order it and it comes back and it's like 70 or 85. Now, obviously, you wouldn't have known that, but these are screening tests, right? So you're ordering the test to screen for diabetes or prediabetes. Yeah, if the sugar is like 130 or 140, maybe you want to order a follow-up A1c, but that's a follow-up A1c. So I don't think that it's necessary to order an A1c on every single patient, especially in the outpatient setting. It's just not necessary. Now, if they have diabetes already or they have prediabetes, absolutely, I would order an A1c probably every 3 months. But as you can see from these recommendations, yeah, you should screen people age 35, blah, 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 for diabetes or prediabetes. But you can use a fasting plasma glucose for that. You don't need an A1c to do this. You can just simply order the CMP, or comprehensive or complete metabolic profile, which contains, your sodium, potassium, etc., and glucose. And that should be sufficient. Now, when we ask patients to get blood work, we usually ask them to fast for it, or we say, don't eat anything after midnight, which, by the way, is its own kind of thing. I have a whole spiel about that, because when people don't eat after midnight or they fast, they usually don't drink water. And it's kind of a double-edged sword, because if you don't drink enough water, then it's going to be hard to stick you. So please remember that when we say don't eat anything after midnight, you please drink water. It's important to drink water to get your blood vessels full and easy to draw blood. Okay, but that's besides the point. When we ask someone to fast, it gives us a lot of information. There's a lot of reasons to ask someone to fast. You know, the triglycerides, the lipid panel, but also the fasting plasma glucose. It's going to be important for us to know what the fasting glucose is. If you just ate chocolate, a big fat cake, you know, just a few hours ago, or minutes before, you'd be surprised. People eat these like fatty foods right before their blood work, in spite of you telling them not to. You'd be surprised. But yeah, I mean, that's going to throw your glucose off all over the place, right? So you just order the fasting glucose, tell your patients don't eat anything after midnight, and that should be sufficient for the A1c. So I hope you learned something from this video. It's a broad topic, diabetes, and there's a lot of nuances, but the whole gist of this video is to basically tell you, order your A1c on patients who need it. And again, it's all based on the clinical picture, because if you look at all the guidelines, there's a million guidelines. This is the point where which medicine is probably more of an art than it is a science, because doctors are going to have their own decision makings. Everyone's going to do things a little bit differently. Yes, we do try to follow guidelines and evidence-based medicine, but evidence-based medicine does not tell you everything. It only tells you screen patients for diabetes. It doesn't necessarily tell you how to do it. It depends on which patient you're seeing. Is she pregnant? Is she a teenager? What's their BMI? Do they have a family history of diabetes? Do they have a history of cardiovascular disease? All of these things are important and relevant. And so I hope you enjoyed watching this video. I hope you learned something. Leave a comment down below. Please subscribe to my channel. I really enjoy these conversations because there's a lot to talk about, and medicine is very interesting. So anyway, I'll talk to you all later. Have a good one, folks.